smart, let's think twice. So that's one of the issues I think we have to think very, very clearly, even from our point of view, that should we ask so many questions? Yes, it is imperative. All our clients says, please ask us questions, and we probably something overdo on that. And but we have to have that balance to run ourselves. As far as Prabuddha said that risk capital, yeah, it is true, but at the same time, we also have to understand if we are associated with a pharma-related business, we can't be smarter than the pharma companies where they can take so much risk on a new discovery and we won't take any bit of it anytime. And so some risk skin in the game has to be there. Yes, very small companies cannot do it. But then it might be also like maybe someday either the mom and pop shops of CROs should come up and become giants or strive to become giants, or at some point they would like to see themselves absorbed and not live with the very small means that they're living today. It's very hard in India to bring a merger acquisition concept because most of the companies are almost family run, deep pocket, with lots of ego and lots of baggages. So we have to, but somehow if we could inculcate the culture, then probably it will be good for us to do. I mean, in India, till not a single CRO today on their own have gone public. So we must have to think about that. And I think time has come that we should seriously start thinking and seriously take certain chances and see if we can make a game change here. I think that we have to do.
I think just in my interaction in the industry, when I talk to a lot of PE players, they say that we don't find enough opportunities to invest, and I'm sure some of my friends like Utkarsh and Anand would agree, and they, keep scouting for relevant opportunities. And when we go back to the industry, they say that we don't find enough investors. So I think there is some gap which probably on an institutional framework or we have to look at those. Yeah. So maybe Utkarsh, if you would like to. Okay.
Why is it that you don't see, or we've hardly seen any collaborations between Indian companies themselves? We've talked about innovative partnerships from the West to India, but why don't Indian companies partner amongst themselves? What do you think are the barriers?
Expanding your own universe. So in a big company, if the mandate is you shrink your own R&D stuff, and yet you keep your output going, they jolly well will have to do it. Wall Street will make you do it, and you cannot change that. In India, I have to say that even the R&D heads and other things, they're still on a very expanding mode for themselves. It seems like a territory. And therefore, the thing that still haven't gone into Indian companies very strongly, and it may not be just limited to pharma, that the distinction between a committed liability and a limited liability, even though it may cost a little bit more. Like very few Indian companies, I mean, yesterday 2 days ago, I was reading an article from the Quintiles senior VP that the whole concept of discovering a drug from beginning to end, I'm only doing it, that have to change, and that has to change. And I think Indian companies are still yet to catch up on that. We have seen big companies coming to us. Cost structure is one thing. What they do not understand, that I cannot pay them, I cannot accept a work at their own internal cost, because they have to accept that they're not taking a liability. After this work, if they don't come back, they have full freedom to do so. They may not have that same freedom to do with their own people. So I think there is also a mind change needs to be working there. Indian companies, I mean, it's unfair for me to talk about it when if the representatives are not here. Maybe they can say what is their mindset, why they don't work. As far as the capabilities and the competence is concerned, I think they'll be better off if they work with some of the CROs, because working with various companies worldwide, some of the Indian CROs are very well geared to certain in the certain niche areas. And if it's just too bad that advantages are not taken. But I think it's more like it's a question of territory. And somehow the stock market pressure in India is never so strong like Wall Street, where they have to do things almost what Wall Street dictates. And you people are in that area, and you may have to say something about that. Is there, do the real Indian CEOs, do they really listen to the stock markets? You can tell me, Utkarsh.
Can I just? I think your question is very right, but I don't think it is limited to CROs and companies. If you see the common Indian man to the biggest politician, this is what is happening. We have a tendency of working our way through on others' weaknesses rather than our own strengths. That is what the attitude of the common people here is. One. So competition is most of the times negative competition, and that is what is the reason for creation of negative feelings between the companies. And so there is a very difficult proposition of actually working them together. However, we must realize that this is slowly going to go, because the kind of questions you have raised, these kind of questions are being raised time and again, and there is going to be a time when people try to work out together. There is going to be mergers and things down the line. But I think my side of the story was it's not only limited to the CROs, it's possibly happening everywhere. We have, even in hospital business, we have a big government hospital versus private hospital divide. You know, the government hospital says the private hospitals are cheating on money. The private hospitals say that the government hospitals are treating like pigs. And in the private hospitals, there is a very big competition rather than cooperation for that side.
So we discussed about the chemistry side, the biologic side from the Prabhuda and all. Doctor, I wanted to take your views on how do you see the shift happening on the clinical research and clinical trial side? Do you see what preferences or what are actually now companies looking at Indian partners on the clinical trial side when they are coming to you?
Yeah, just it's a good question. You know, when the Indian market was open to trials, the first thing they looked at is the cheap enforced recruitment and fast recruitment. And that is what started happening. And because of the money which was being offered to people who were practicing physicians, it was in unscrupulous manner, which was leading to a lot of distrust and regulatory hassles. So regulatory framework actually had to lay down certain norms to actually curb down on unscrupulous research which was happening. And now the pharmas are actually looking at people who can go through the regulatory hassles a little bit more cleanly and can also give a clean research data. So what the scenario has changed is from just cost and faster enrollment, which was the primary driving force, is to ethical work along with the cost and things and no regulatory hassles. And I am very clear that now it's another dimension added to it. Wherever there are academic institutions who can add on to development of the protocol, there's a recent trend which is changing that the sponsors are coming on to hospitals which can offer certain improvements. So a lot of Indians are getting into steering committees and into lead investigator roles and things like that. So this is the changing scenario which is happening. And I would say that the vision which we have at MDRI and Medanta would be successful as Indian when Indian molecules, we go out of the country and do the trials on our molecules.
So I think I would like to ask Dr. Das one last important question on. We have seen some of these partnerships being worked on and going very well, but at times they also have to go through the entire gamut of macroeconomic factors. To what extent do you feel that these macroeconomic factors can impact these partnerships? And if you have any case studies in mind, if you'd like to share to us.
No, they do. The macroeconomic factors play a very big role because